Hey YouTube, this is Charlene. I'm back. As promised, I'm making a clinicals video. So first things first, your uniform. This is a part of your uniform. Your stethoscope is a part of your uniform. You need it. Word to the wise, I actually had my barrel with my name inscribed on it. I don't know if you can tell right there. There's my name, and then I also had a nice little saying written on it. But I suggest you putting your name on this somehow, some way, because everybody's not honest. Also, you need your actual scrubs. Please iron them. Don't show up to clinical with your scrubs all wrinkly. I just pull these out for the sake of the video, but please make sure you iron them. I also always wear a long sleeve shirt underneath my scrub top because it's freezing cold in hospitals and I get cold easily, and I'm not for the jacket. It's just extra stuff to wear and it gets in the way. Also, don't forget your white shoes. Something else that helps me quite a bit are compression socks. Strongly suggest you wear these with your uniform. You need these compression socks. You will thank me later. Okay, so now that we have that out of the way, make sure your hair, of course, is pulled back out of your face. Some schools allow this where it's off of your face. Some schools want you to have it in an actual ponytail. So those are things that are critical to remember. Remember, no jewelry outside of your earrings. I do wear a smartwatch. I love it because I have it programmed. I have the timer set here so that if I'm taking a patient's vitals, etc., I can just hit the timer and then I don't have to worry about that. Because sometimes when you're taking their vitals and you're watching the clock, you misstep your count. So thank you, Apple Watch. Okay, so on to other things that you need to make sure that you're mindful of. One, be early. We have to arrive at 6:30. I do my best to be there by 6:15, and if I'm really lucky, I try to get there by 6. Just because you never know what's going to happen, and you always want to make it in time to get shift change report. That is critical. So always be early and always have your things. Speaking of things that you need. So my school required, I had to have at least 3 sets of paperwork with me at any given time. One was my checklist. So you'll get a skills checklist that your instructors say by the end of the semester you need to have so many of these checked off. And this is what my checklist looked like. And every time I performed one of them correctly, the nurse, of course, had to supervise. She would sign off for me, or my instructor would sign off if she was present. We also had daily documentation. So this is what my daily documentation looked like. On the front side, you just put the client information. So basically you do their background, their vitals, type of diet they're on, if they're on glucose monitoring. On the back side, I put my assessment data. So once I did my head to toe, so once you introduce yourself, you will assess your patient. I put that information there, and then you come up with your nursing diagnosis. Let's be clear. Sometimes this does not come from your immediate assessment, which means you have to spend time with your patient. I repeat, you have to spend time with your patient. You can't just go in and put the assessment and then think, I'm gonna go grab this book and come up with an assessment and then spend the rest of your time trying to come up with interventions, etc. No, spend time with your patient. This comes very easily. Okay, after that, you also have to write your nurse's notes. So once you enter the room, how was the patient? What did they look like? Were they responsive? Are they alert and oriented? What did you see? What did you do? You do not write double information. So whatever you wrote for your assessment, the patient had a 4-inch scar on their backside. You don't have to write that over here. You're just writing your outtake of what took place, okay? And then on the last page, you have to write medications. The medicines that you're gonna write, at least for my school, are the medicines that I administered. I'm not gonna write things that I did not give, because when you take your nurse's notes, when you are a registered nurse, you're not gonna write that you gave the patient such and such and such, and you didn't do that. You're gonna turn this in at the end of every shift. Every single shift you do, you're gonna turn this in, okay? And then there's a care plan. So this is my last care plan, which means I had to come up with 2 diagnoses versus 1. And so the way that they look, this is the rubric you put on the front, and then on this side you put my nursing diagnosis here, And then this is my second nursing diagnosis that I have for this patient. So you put just a little brief background of the patient, and then you put the diagnosis, and then you over here you put your subjective and objective data as to why you felt like that was a good diagnosis. And then on the next page, you take the diagnosis and then you put your interventions. And then of course you have to have your references, which brings me to the book. This is our NANDA book. It's a Mosby's Guide to Nursing Diagnosis. It is pocket size. They do have a large version. Our school was very smart and told us to get the pocket size. I take this with me to every clinical. This is also the Jarvis Physical Examination and Health Assessment. Okay. Again, this book comes in a very large version. We have the pocket size version. I strongly suggest you get a pocket size version, because if you don't know how to properly assess, or if there's something that you may be forgetting, you can quickly look it up. It has diagrams and pictures, and you're able to thoroughly and properly assess your patient and know if the assessment is normal or not. So I take both of these with me to every single clinical. Okay. What else? So I also have my where do I keep my papers? On this clipboard. I love this clipboard. It's the white coat clipboard for nurses, because they do have one for medical doctors. This one is for nurses. Just an FYI, I did learn that this is like the hamburger version where it closes down. They do have a vertical version that closes this way, and it's longer, like a hot dog. It's long as a hot dog. You can find these on Amazon. Strongly suggest they fit in your pocket. They're very easy to write on when you're trying to take a report in the morning. It's a perfect thing to write on. One resource that was new to me that I really enjoyed using this semester was the RnNotes. This was a little expensive. It was about $30-ish, almost $40. And I was like, is it really worth it? It is. Couple things I like about it. You can write in it and erase your writing. It has this funny kind of material that if you waste something on it, it just falls right off, so you don't have to worry about it being damaged. You can place Post-its. You can place sticky notes here and keep them, which is a great thing. And then it has everything. It's really, really, really been a lifesaver. I strongly recommend it. Okay, so all the things that are in my bag. This is my bag that I use. It's the perfect size because it holds everything that I need, and it's very portable. Okay. I took everything out, but just so you know what goes inside. So all this stuff, all the books, okay, my clipboard, this lotion, you need it. Your cuticles are going to be super dry if you wash your hands like you should, which means you need hand sanitizer, okay? I keep gum or a mint in here because you are in patients' faces all day. So if you're a coffee drinker, or if you're a person who just has bad breath in the morning, or whatever the case may be, or you may have just been walking around and not eating or drinking all day, sometimes you're prone to bad breath. Do us all a favor, okay? Pens and pencils, markers, you need those. I use a highlighter to highlight important stuff on my own personal paperwork. I also keep Post-it notes. This is the type of Post-it note that I use in case there's something important that I need to write down or remember to grab when I'm out of the room. Okay, ladies, you need these. Pads, panty liners, whatever the case may be, they need to go in your bag. Keep some in there at all times. Alcohol wipes. I take an emergency pack. I usually try to keep 2 or 3 in my bag because you're around sick people all day. You need to keep yourself in good health. Hemostats, as well as shears, which are scissors. For some reason I cannot find mine, so I'm gonna have to go on that hunt. Water or coffee. Stethoscope, if I haven't said it already. Lunch, snack, money to buy things, cash money, because sometimes the hospital's cafeteria is closed and you need to go to the vending machine, and they all don't take credit cards. Always try to keep a snack like crackers or something quick that I can get to, grapes, something that's not going to make you lethargic. I can't stress this enough. When you eat lunch, don't pig out because you're going to be sleepy. Eat just enough to give you that boost of energy and keep it moving. Don't go down there and just, no. So that is my little spiel on clinical. Some other quick tips. When you first get there, introduce yourself to the charge nurse and ask for your nurse. If your clinical instructor does not do that for you, which more than likely they will. When you greet your nurse, introduce yourself in a professional manner. Make sure they know what you're capable of doing. I always tell them off bat, this is what I can do. So they already know this is my limit. Okay, I can do all this up through here, and I just list off everything that I'm already checked off on, which is what you can do with their supervision. And then if your instructor is very strict about certain things, then you need to let them know. Okay. When you go over them with their patients, I always go through rounds. So I go through every patient, and once we get all the patients, I tell them I feel like I can do this patient or that patient. I ask them for their advice, and we 9 times out of 10 we agree. Once you get your patient, the first thing you need to do is write down the medications, because usually after you go in and introduce yourself to the patient, you're going to be giving morning meds. So you need to know what you're giving the patient. You need to know what it's going to cure, so what kind of therapeutic, not cure, sorry, but what it's going to treat, so what kind of therapeutic effects it's going to have, and then also at least 2 side effects. I try to give them at least 2 side effects of things to expect, so that when these things take place, they know this is normal. Okay, it's a normal side effect. But if it goes beyond this point, or if you start experiencing these side effects, you need to contact us immediately. Okay. So always know that. Always know what the patient has. Know the patient's name. Know what the patient's current status is. You can have a patient come in there, like as for example, at an LTAC, they came in with heart issues. No longer necessarily have those issues, but they're having something else that's currently exacerbating and that needs, different type of attention. And so your nursing diagnosis wouldn't be related necessarily to the heart condition, but to what they're experiencing at the moment. So that's something you have to keep in mind when you're talking about acute care versus long-term care. Okay. Be proactive. Okay. What I mean by that is, once you finish your first semester, so first semester is more like CNA stuff, where you're taking vitals, you're changing the sheets, you're bathing the patient, you're helping them eat, etc. Second semester beyond, your skills expand, and so you can do more things like administering IV fluids. You can start an IV, you can start a Foley. So you don't necessarily do the CNA things, and then also you have a CNA under you. So and I don't mean like, you should understand what I mean by that. You have a CNA that assists you in what you're trying to do. Okay, so you no longer do those things unless they're not available and you need that information. Okay, so keep those things in mind. Be proactive about that. Don't just, well, my patient's good, so I'm just gonna sit here. No, help your nurse out. I always help my nurses out, even though I have that 1 or 2 patients, because at the end of the semester I ended up with 2 patients. Okay, I ended up with 2 patients at a time for my last 2 clinical shifts. And so I still help my nurse. There are some students who just look after their patient and that's it. No, I'm trying to help her. What else do you need me to do? What can we do? As long as it's not taking away from my time with my patient and I'm not off track, I don't mind helping at all. That helps them. It makes the shift go easier. They can educate you a lot better, and things just run a lot smoother. Okay. So find things to do. If you just have a patient that's just perfect, then they don't really require much of your attention. Ask questions. Don't just do things if you don't know how to do them. That's 2 different statements, by the way. So if you don't know how to do something, or if you've forgotten, either look it up, ask your classmate, or ask your nurse. Just be like, you know what, this was forever ago. I don't remember. Can you rebrief me? And 9 times out of 10, they will. When you go in there doing things that you don't know how to do, you're going to get in trouble. Okay, so ask questions. Just be like, okay, why did you do that, or why did you choose this method? Because certain nurses have a certain way that they do things simply because it's more beneficial for them. May not be beneficial for you, but you'll learn some things that you feel like are positive and that will help you. Take them with you. Learn how to do them over time. Practice on each clinical, and they'll help you, and soon enough you'll have your own method. You have your own method to your own madness. So, and one other thing I cannot stress is what my instructor always stressed with us: take your lunch and your breaks. She said if you're not able to do it now, you won't be able to do it when you're a nurse. That's all I have to say about that. I hope that this was resourceful. I hope that it was good for you guys. If you have any questions, please feel free to ask. I'm going to make one more video about how I'm preparing, because 3rd semester starts tomorrow. Bye guys.